Pneumoconiosis. Pneumoconiosis is a group of occupational lung disease caused by inhaling inorganic dust particles, usually over a long period. These particles accumulate in the lungs, causing inflammation and fibrosis or scarring. It is a restrictive lung disease that limits the lung's ability to expand during inhalation. Now, what are the types of pneumoconiosis? Well, pneumoconiosis can be of several types like silicosis, coal workers pneumoconiosis, asbestosis, berylliosis, sidrosis, stenosis, and beritosis. Talking about silicosis, it is caused by inhaling crystalline silica dust. It is common in people who are indulged in mining, sandblasting, and quarrying. It increases the risk of tuberculosis. It can be chronic, acute, or accelerated. Coal workers pneumoconiosis, also known as black lung disease, it is caused by inhalation of coal dust and can progress to progressive massive fibrosis. Asbestosis is due to asbestos fiber exposure, which is seen in people involved in construction, shipbuilding, and insulation work. Asbestosis is associated with mesothelioma and bronchogenic carcinoma. Berylliosis. Inhalation of beryllium, a metal which is used in aerospace and electronics, cause berylliosis. It can present as an acute or chronic condition. Sidrosis, stenosis, and barytosis. Well, sidrosis is caused by iron inhalation, stenosis is caused by inhalation of tin particles, and barytosis is caused by inhalation of barium particles. These are generally benign without significant fibrosis. Now let's talk about the pathogenesis of pneumoconiosis. Well, when there is inhalation of inorganic dust, there is deposition of those dust particles in the alveoli and terminal bronchioles, activation of the alveolar macrophages to phagocytize those particles. Inflammatory cytokines are released by the macrophages, which causes recruitment of more inflammatory cells and persistent inflammation and oxidative stress, leading to stimulation of fibroblast and collagen production, and causing fibrosis and scarring of the lung parenchyma, which leads to loss of the alveolar capillary surface area, decreased lung compliance, and restrictive lung disease. The patient could present with chronic cough, dyspnea, fatigue, chest tightness, and in severe cases, respiratory failure and right heart failure. To make a diagnosis, a history of occupational exposure is required. The chest X ray or HRCT scan can show nodules, fibrosis, eggshell calcification in cases of silicosis. Pulmonary function test shows a restrictive pattern, and bronchoalveolar or lung biopsy is required in some cases. There is no cure of pneumoconiosis. Focus is on prevention and supportive care. Avoid further exposure to the causative dust, cessation of smoking, oxygen therapy in advanced cases, lung transplantation in end stage disease. Prevention. Prevention is of utmost importance. Use of personal protective equipment should be done. Dust control measure in workplaces. Regular health surveillance of the workers and educating workers about hazards. Thank you and bye for now. Do subscribe to the channel if you're liking the videos.